Welcome again to another episode of Tiny Matters with Dr. K. I am Dr. Kuto Sibitsiba. A little boy once came into my rooms. Let's call him Tato. Before his mom had had a chance to sit down, he had opened 2 drawers, taken my stethoscope, pressed buttons on my laptop, and was running around the room pretending to be an aeroplane. His mom looked exhausted. In frustration, she looked at me and said, "Dr. K, I think he's just really naughty." I remember looking at him and thinking, but what if he isn't? What if there's something else going on? That's what I want to talk about today. The child we call naughty. After years of looking after children, one thing has become very clear to me. Children are very good communicators, not always in speech, sometimes in behavior. I'm not saying children don't misbehave, because sometimes they do. They test boundaries, they talk back, and often they make really poor choices. Sometimes behavior is not just behavior, it's information and is an important clue as to something else that may be going on. So how do we know when misbehavior is not just ordinary misbehavior? Because let's be honest, not every tantrum has a diagnosis. Not every meltdown is autism. Not every busy child has ADHD. Sometimes a 4-year-old throwing his toys out the cot is exactly that. What makes me worry is when that behavior becomes persistent, extreme, or completely out of range for what we expect for that child's age. If it's suddenly different from that child's personality, or when it starts affecting school relationships or relationships with friends and family. That's when I stop asking, how do we make this child behave? And start asking, what could actually be getting in the way? So what could we be missing? Let's start with a simple thing. When last did this child get a good night's sleep? Because sometimes tired children don't look sleepy. They look hyperactive and they look irritable, emotional, impulsive, or unable to concentrate. A child who snores loudly may breathe through their mouth and struggle to get a full night's sleep without frequent arousal. The next morning we say, he can't concentrate, or he's naughty. She won't sit still, or he's so moody. When we're simply missing a child who is exhausted. I've seen many children whose daytime behavior improved significantly once their sleep symptoms had been resolved. So before we assume that a child is badly behaved, let's check how their nights are going. What if they're not ignoring you? Tato! Nothing. Tato! Nothing. I've called you 3 times! Sound familiar? We've all seen it. But sometimes children genuinely can't hear properly. Glue ear and other hearing disorders can be surprisingly deceptive. A child doesn't need profound hearing loss to struggle in a noisy classroom. South African school screening research have found that 2% of children have hearing loss. Now, if you take an average South African class with 30 to 40 children, that's about 1 child in every 1.5 classrooms. So what might that child look like? Distracted, not able to focus, fidgety and busy while the teacher's trying to teach, always asking what and falling behind, apparently ignoring the teacher. So sometimes the child that seems to not be listening may be struggling to hear. And so if they're hearing properly, are we sure they can see? Imagine sitting in a classroom and not being able to clearly see what is written on the board. Eventually, you'll stop trying. Maybe you'll start scribbling in your book. Maybe you start talking. Maybe you avoid the work. Maybe you become the funny child, the joker of the class. Because sometimes for children, it's easier to look naughty than admit, I can't do this. The same thing applies to learning difficulties. If every single worksheet reminds a child that they don't understand what every other child is understanding, naughty behavior can seem like an escape. So when the behavior mainly happens around schoolwork, ask yourself, are they struggling to learn or simply refusing? These are very different children. And another one, could it be ADHD? You'll remember we discussed this previously, so be sure to check that episode out. absolutely could be ADHD. Remember, ADHD affects things like impulse control, activity levels, behavior, and executive function, which affects things like planning, organizing, initiating or starting a task, following instructions, waiting, controlling impulses, and regulating emotions. And here's something I really want parents to understand. A child can know what they are supposed to do and still struggle to do it. That's why shouting at them doesn't always solve the problem. They may know better, but putting that knowledge into action may be extremely difficult for them. What if it's something emotional rather than medical? Definitely could be. Take anxiety. When we imagine an anxious child, we always assume it's that child quietly sitting in the corner, fidgeting and not talking to anybody. But anxiety in children can be surprisingly loud. It can look like irritability, anger, perfectionism, school refusal, control, tummy aches, avoidance, and meltdowns. So sometimes the child that everyone calls naughty doesn't need another lecture. Sometimes they need us to ask them, "Are you okay?" What if they simply don't have the words? Think about a child with a language or speech delay. They try to tell you something, you don't understand. They try again, you still don't understand. Eventually, they hit, they scream, they throw tantrums. And instead of focusing on why the behavior happened, the attention becomes that the behavior happened. But the problem started much earlier. Before the hitting was a child who struggled to communicate and failed. What about autism and sensory overload? For a lot of children, the world can seem incredibly intense. Noise, bright lights, noisy classrooms, scratchy clothes, certain textures, certain sounds, a busy shopping center. Something that seems completely ordinary and mundane to us can be extremely overwhelming to them. And that's why it's important to understand the difference between a child who is intentionally pushing a boundary with a child that has just reached their limit. Our response to these children shouldn't necessarily be the same. Could something as simple as constipation affect behavior? You knew I'd find a way to bring constipation into this episode. But yes, having abdominal pain can affect behavior in many different ways. You're not sleeping properly, you're uncomfortable at school, you want to use the toilet but not really, you're not eating well and so you're irritable. Chronic pain, iron deficiency, and headaches can all affect the way a child functions during their school day and from day to day. Sometimes their behavior is simply a child's way of saying, "I don't feel well." So what if the problem is not the child at all? What could be happening around them? Bullying, a new sibling, parental conflict or separation, a death, a move, a frightening experience. Children don't always sit down with us and say, "I've been struggling emotionally since the situation changed." Sometimes it shows up in their behavior. They can become clingy, aggressive, withdrawn, struggle to focus, or struggle to sleep. That's why a sudden change in behavior must always make us think, what has changed? So does understanding behavior mean we should stop disciplining our children? No. And this is really important. Understanding bad behavior doesn't mean we accept it. Children still need boundaries. A child with ADHD still needs boundaries. An anxious child still needs guidance. A child who's overwhelmed is still not allowed to hurt other children. So when should we actually seek help? For this, I would remember 4 things: severity, impact, persistence, and change. How extreme is this behavior for the developmental change? How has the impact been on the home environment, the school environment, and his social interaction? Has it been going on for a long time? And is there something I can point to that shows us that it's a change from how my child normally behaved? If there's one thing I'd like you to take away from today's episode is this: the next time someone worries that their child is naughty, let's take a step back and pause for a moment. Maybe they're testing a boundary. Maybe they need firmer limits, absolutely. But perhaps let's ask one more question before deciding. Could there be something else going on? Because I've met children who couldn't hear properly, children who couldn't sleep, children with ADHD, and children with autism, children struggling to learn, children carrying so much anxiety, children who couldn't communicate what they needed, children who were uncomfortable, children dealing with things at home or around them that adults were not aware of yet. And from the outside, many of these children look naughty and difficult. So yes, correct behavior, set boundaries, and teach consequences, but remain curious about the child underneath it. So I know as parents that sometimes it may be easier to think our child is just naughty rather than to accept that there may be something medical going on. My advice to you, as usual, is to trust your instinct and call for help if you think that there may be something else going on. Thank you for joining me for another episode of Tiny Matters with Dr. K. If this episode resonated with you, feel free to share it with another parent. Until the next time, stay kind and stay curious.